So I'm at the annual ASH 2019 meeting here in Orlando, Florida. And there have been some, I think, very exciting early clinical breakthroughs with some very novel compounds that I would like to take just a few minutes to discuss because I think they have the potential to change the overall treatment landscape of AML over the next several years. So one of these very exciting new compounds is right now a compound known as APR-246, which is a small molecule that works against P53, the mutant P53 protein, by binding to it and leading to a structural conformation change that actually restores normal P53 activity to that mutant P53 protein. So this would obviously be of great interest in P53 mutated diseases, especially MDS and AML, where we see reasonably high rates of mutation of this particular gene. And at this meeting, we're going to hear about a follow-up result presentation of a phase 1/2 trial of APR-246 plus 5-azacitidine in high-risk MDS and AML. And the results look very encouraging with high response rates utilizing this combination of APR-246 and azacitidine in patients with P53 mutated MDS and AML. So this is a drug, I believe, that has the chance to change the landscape of how we approach P53 mutated myeloid malignancies. And we look forward to hearing more about these results and the results of an upcoming or currently in process phase 3 trial in MDS. Another very exciting compound that I think is worth talking about is a drug called Kusa Twosome AB, which is an anti-CD70 antibody. We think CD70 is important as it is often expressed on leukemic stem cells, and the ability to modulate leukemic stem cell activity in the overall treatment paradigm for AML is quite important. So this compound was tested, this Kusa Twosome AB, tested in an early phase trial in combination with 5-azacitidine. And what the data are showing to date are the ability of this antibody to reduce the blast levels of patients who received drug on this trial even before the azacitidine was begun. And then after the combination therapy was undertaken, the large majority of patients had a complete response to this combination. So as it pertains to anti-leukemic stem cell therapy, I believe that this is an important compound, a targeted therapy that has some important implications moving forward, and we'll look forward to seeing more data about this compound in combination with azanucleoside therapy. And then finally, we're seeing a very, I think, exciting breakthrough in the arena of maintenance therapy. And for many years, we've been unsuccessful at maintaining remissions in high-risk patients with AML and dealing with a very high risk of relapse. So there's been a lot of interest in developing maintenance therapies to help maintain remissions as long as possible. And one strategy for doing that is to incorporate azacitidine, a hypomethylating agent that's currently used in many phases of the disease, but as an oral formulation. And the oral formulation, known as CC486, has the advantage of being able to be given as an oral formulation on a daily basis. And by doing so, this drug is able to create a hypomethylating effect that persists for the duration of the treatment cycle. And this prolonged hypomethylation effect is thought to be important in achieving response to these types of agents. So as it pertains to AML patients in remission, a phase 3 trial was conducted comparing CC486 against placebo in older patients with AML in first remission. And the primary efficacy endpoint of overall survival after treatment with this maintenance regimen indicated an overall survival advantage with the CC486 compared to placebo. And I think for the first time in a large randomized setting demonstrated the utility of pharmacologic maintenance therapy as a way to modify the disease in a favorable way that allows patients to live longer and with longer remissions in this very difficult to treat situation. So we're very excited about the prospect of this compound moving forward and exploring additional settings in which it can be used and other combinations, but for now it looks very promising in the maintenance setting and hopefully will change the field for the better with respect to prolonging remission for these patients. So these are a few of the very exciting compounds that I think are either in development or further along in development that are going to be practice changing in the not too distant future.